1. What is the primary role of the College of Nurses of Ontario CNO in regulating nursing practice? A. To provide educational programs for nurses. B. To protect the public by ensuring nurses are qualified and practice safely. C. To promote nursing advocacy within hospitals. D. To offer scholarships to nursing students. 2. Which of the following is an essential component of the CNO's Continuing Competence Program? A. Practicing in a specific specialty area. B. Completing mandatory continuing education courses every year. C. Reflecting on practice and engaging in professional development. D. Collecting patient satisfaction surveys. 3. What is the purpose of the CNO's professional standards? A. To guide the public in choosing the right nurse. B. To ensure consistency in nursing practice across Ontario. C. To define the scope of practice for nurses in Ontario. D. To regulate nurse salaries. 4. Which document outlines the legal and ethical responsibilities of nurses in Ontario? A. Nursing Act, 1991. B. Health Promotion Act, 2000. C. Canadian Nurses Association Code of Ethics. D. Occupational Health and Safety Act. 5. What is the primary responsibility of a nurse in relation to patient confidentiality? A. Share information freely with family members. B. Maintain patient confidentiality unless given consent to share. C. Disclose all patient information to the healthcare team. D. Ignore confidentiality in emergency situations. 6. In which of the following situations would a nurse be required to report a concern to the CNO? A. A colleague is frequently late for their shifts. B. A nurse fails to meet the CNO's continuing competence requirements. C. A nurse disagrees with the treatment plan. D. A nurse does not greet patients warmly. 7. What is an example of a boundary violation in nursing practice? A. Referring a patient to another healthcare provider. B. Discussing personal feelings with a patient. C. Offering emotional support during a difficult procedure. D. Providing appropriate pain management to a patient. 8. What is the purpose of a nurse's scope of practice as defined by the CNO? A. To set limits on the tasks a nurse can perform. B. To ensure nurses are paid fairly. C. To guide how nurses communicate with patients. D. To control which hospitals a nurse can work at. 9. What is the significance of the CNO's entry to practice competencies? They ensure new nurses have the required skills and knowledge for safe practice. B. They allow nurses to specialize in a certain field of nursing. C. They guarantee a nurse's job placement upon graduation. D. They regulate nurse salaries. 10. Which of the following actions is considered a violation of professional conduct under the CNO? A. Administering a medication as prescribed. B. Making false statements about a colleague's practice. C. Attending a professional development seminar. D. Documenting patient care in a timely manner. 11. What is the CNO's requirement for a nurse to engage in reflective practice? A. Completing a journal entry every week. B. Writing an annual performance review. C. Analyzing their own practice to improve patient care. D. Attending a mandatory meeting each month. 12. How does the CNO ensure nurses stay up to date with best practices? A. By conducting random inspections of hospitals. B. Through the Continuing Competence Program and practice assessments. C. By providing free training on a yearly basis. D. By conducting surveys of patients and families. 13. What should a nurse do if they encounter a situation that is outside their scope of practice? A. Consult a colleague for advice. B. Seek guidance from a supervisor or another healthcare professional. C. Continue with the task if it seems simple. D. Ignore the situation and focus on other tasks. 14. What action should a nurse take if they feel that their own practice is unsafe? A. Continue working as usual and trust their judgment. B. Speak to a supervisor or consult the CNO for guidance. C. Report the situation anonymously to the CNO. D. Leave the job immediately without any explanation. 15. What is the CNO's perspective on cultural competency in nursing practice? A. Cultural competency is optional for nurses. B. Nurses are encouraged to provide culturally sensitive care. C. Nurses must follow only one cultural approach to care. D. Cultural competency is limited to communication skills only. 16. Which of the following is part of the CNO's professional conduct guidelines? A. Nurses are expected to maintain boundaries with patients. B. Nurses should always work independently without consultation. C. Nurses should only focus on physical health and not mental health. D. Nurses must attend every social event hosted by their hospital. 17. How should a nurse handle a situation where they suspect a colleague is impaired while on duty? A. Ignore the situation unless it directly affects patient care. B. Report the concern to their supervisor or the CNO immediately. C. Confront the colleague privately. D. Ask other staff members to handle the situation. 18. What is the CNO's role in the investigation of complaints against a nurse? A. To immediately suspend the nurse from practice. B. To investigate the complaint in accordance with the professional standards and regulations. C. To offer professional development training to the nurse. D. To provide a final judgment without further investigation. 19. How should a nurse demonstrate professionalism in their practice? A. By treating all patients with respect and dignity. B. By avoiding involvement in hospital policies. C. By maintaining a formal relationship with patients only. D. By focusing only on technical skills and not patient relationships. 20. Which of the following is a key aspect of the CNO's communication guidelines? A. Nurses should limit communication with patients to just clinical matters. B. Nurses should listen actively and respond appropriately to patients' needs. C. Nurses should avoid difficult conversations with patients. D. Nurses should communicate with patients through text only. 21. What is an example of an ethical dilemma a nurse might face? A. Deciding between two equally effective treatment options. B. Providing care in a busy hospital environment. C. Adhering to a strict shift schedule. D. Handling medical records with care. 22. What does the CNO's practice guideline for ethical decision-making emphasize? A. Making decisions that benefit the nurse personally. B. Ensuring decisions are based on principles of fairness, respect, and professional judgment. C. Avoiding involvement in difficult patient cases. D. Focusing solely on medical facts without considering patient preferences. 23. What is the CNO's approach to the use of technology in nursing practice? A. Nurses should only use technology when absolutely necessary. B. Nurses are encouraged to integrate technology to improve patient care and safety. C. Nurses should avoid any form of electronic record keeping. D. Nurses should focus on traditional, paper-based documentation methods. 24. What is the role of mentorship in nursing practice, according to the CNO? A. Mentorship is not required in nursing practice. B. Mentorship helps new nurses develop the skills and knowledge required for competent practice. Mentorship is only for advanced practice nurses. D. Mentors should focus solely on administrative skills. 25. What is the CNO's stance on nurses' involvement in research? A. Nurses should avoid research involvement. B. Nurses are encouraged to engage in research to improve patient care practices. C. Nurses must focus on direct patient care and avoid academic activities. D. Nurses should limit research to administrative functions. 26. What is the CNO's position on collaboration in healthcare settings? A. Nurses are expected to work independently and avoid collaboration. B. Nurses should collaborate with interdisciplinary teams to enhance patient care. C. Nurses should only collaborate with physicians. D. Nurses should avoid collaboration when busy. 27. What is the CNO's view on the importance of self-care for nurses? A. Self-care is not relevant to professional practice. B. Nurses should prioritize patient care over their own well-being. C. Nurses are encouraged to practice self-care to ensure they can provide safe and effective care. D. Self-care should be limited to physical health only. 28. How can a nurse ensure they are meeting the CNO's practice standards? A. By following prescribed treatment plans without deviation. B. By continuously evaluating their practice and seeking feedback. C. By working independently without external input. D. By only focusing on the technical aspects of care. 29. What is the CNO's approach to addressing unsafe practice? A. Ignoring minor mistakes and continuing with practice. B. Reporting unsafe practices to supervisors and engaging in remedial actions. C. Accepting unsafe practice as a part of nursing. D. Only focusing on major safety issues and not minor errors.